Scoliosis. What is scoliosis? Scoliosis is defined as a lateral curvature of the spine with a Cobb angle of more than 10 degrees measured on an X-ray. It is often occupied by a vertebral rotation, and Cobb angle is a measurement used in radiology and orthopedic surgery. Scoliosis has several names. It goes by idiopathic scoliosis, which has three branches: infantile, juvenile, and adolescent. There's also congenital scoliosis, neuromuscular, syndromatic, degenerative, functional, and spinal curvature or curvature of the spine. Scoliosis affects many systems in the body, such as the musculoskeletal system. The determinants of this one is chronic back pain, reduced mobility, and in severe cases, spinal instability. It also affects the respiratory system. The determinants of this is shortness of breath, reduced exercise tolerance, and in extreme cases, respiratory failure. It also affects the cardiovascular system. The determinants of this one is reduced cardiac output, pulmonary hypertension, and in rare cases, copulmonary, which is a type of right-sided heart failure. There is also the psychological impact. The determinants of this one is reduced quality of life and social withdrawals. And in severe cases, the nervous system can be affected. The determinants of this one is nerve compressions may lead to numbness, tingling, or weakness in the limbs. Loss of, in rare cases, severe spinal cord compression can lead to a loss of control over bladder or bowel movement.
All right, so for the progression of scoliosis, that refers to the angle of the lateral spine curvature increasing. So the rate of the progression depends on two things: the age. So it's more likely to worsen if a person's bones are still growing. So if you're a kid, then it's likely to get worse. And then also the type of scoliosis. So as I mentioned, the progression of scoliosis is very dependent on the type. Congenital scoliosis is usually unpredictable. Neuromuscular can be rapid and severe. Um, de- Degenerative is usually pretty slow. Syndromatic, it varies, can be rapid and severe. Functional does not worsen. And then for the most common kind, idiopathic, after puberty, a curve less than 30 degrees is unlikely to progress. A curve between 30 and 50 degrees will probably progress about 10 to 15 degrees over the course of your lifetime. And then curves over 50 degrees will usually go about 1 degree every year. There's also rapid onset scoliosis, which is when the spinal curvature suddenly progresses at an unusually fast rate. This is normally more than 10 degrees in 6 months, and it often indicates an underlying medical condition.
When it comes to the impact of exercises on scoliosis, they can help reduce the progression of the curves and aid with quality of life. Most commonly used are scoliosis specific exercises, as some other exercise can increase the rate of progression or create damage. For example, lifting heavy weights over the head will increase pressure on the spine, and since the spine is already not supported enough, it would not be ideal to do an activity like that. Growth exercises or scoliosis specific exercises that help improve posture, reduce pain, and promote conscious postural control. And when we talk about pain, we have to remember that there are multiple factors involved, such as biological, psychological, etc. And just because somebody is diagnosed with scoliosis does not equal that they will 100% experience pain. Exercise alone may not be enough in some cases. For example, when the club angle is between 25 to 50 degrees in thoracic region and 20 to 40 degrees in the lumbar region. In these cases, they will sometimes require braces alongside a supervised exercise program. And for when the club angle is over 50 degrees, then that's when they would most likely need surgery. However, surgery is not always possible. They would always need to check the severity of the angle and if surgery is possible or not. There are several studies out there on the impact of exercises on scoliosis. One that assessed the effectiveness of strength exercises and core stabilization on adolescents with idiopathic scoliosis. And the results were that the subjects who were in the strength groups experienced improvement in trunk rotation, spinal mobility, whereas the one in the core group experienced improvement in lumbar trunk rotation. Another one, it says the impact of exercise programs in addition to spinal orthosis in individual with neuromuscular scoliosis, and it proved to be efficient in supporting patients with physical capacities and increasing muscle strength and balance, and also helped better respiratory functions. For example, um, the degree of impairment in forced vital capacity dropped from 17.56% with anorthosis to 9.28% following a 4 week physical therapy treatment.
All right, now let's talk about scoliosis specific exercises and their benefits. So scoliosis specific exercises are designed to strengthen the muscles, improve posture, and potentially slow down the progression of the curve. These exercises work best when combined with bracing and proper physical therapy. Some key benefits include better spinal alignment, improved flexibility, and increased muscle strength to support the spine. Now, unlike general exercises, scoliosis-specific exercises focus on targeting the asymmetry of the spine and to create more of a balanced posture.
There are two well-known exercise approaches that have shown promising results. The Schroth method is a three-dimensional exercise approach that helps improve spinal curvature and posture. It involves guided breathing techniques and targeted muscle strengthening to correct imbalances. Studies have shown it can improve quality of life and help reduce the progression of scoliosis. The SEAS approach, or Scientific Exercises Approach to Scoliosis, focuses on self-correction during daily activities. Instead of isolated exercises, it helps individuals integrate corrective movements into their normal routines. The goal is to train the nervous system to support better spinal stability.
Is it always safe to exercise, or are there side effects? It is not always safe to exercise with scoliosis. It depends on two major things, and those are the type of exercise as well as the type of scoliosis. What types of exercise can you safely perform with scoliosis? So people with scoliosis can perform any low-impact aerobic exercise. This can include yoga, Pilates, and any type of core strengthening exercise. What types of exercise should you avoid if you have scoliosis? The types of exercises you should avoid include any type of heavy weightlifting, swimming, repeated jumping, and gymnastics. Side effects if you did these exercises with scoliosis. So if you've done any exercises that you should have avoided, some side effects can include an increasing in pain, worsening of spinal curvature, posture deviations, and just an overall increased risk of injury.
All right, so now that just about concludes the presentation. If you guys have any questions, now's the time.